The impotence is the inability to obtain or to keep an erection enough to achieve satisfactory sexual activity, and it has multiple causes. But some people might have sporadically an episode that the erection is not the quality they would like, and if the next erection is adequate, it shouldn't be a big deal. If this is persistent, that might indicate the presence or the or potential problems. But a lot of common conditions could cause erectile issues, and what is important to understand is that the erection and intimacy is very complicated. Why? Because it has first mood, everything needs to be right. Second, you need to have nerve, muscles, blood vessels, musculature, muscles.
A lot have the orchestra, all the members of the orchestra have to be playing harmoniously.
And everything could be affected through different instances, situations, conditions, diseases. So it is important that ED, if it's persistent, has to be evaluated, because it could precede multiple things for the future. Like some studies have shown that erectile dysfunction could precede 3 to 5 years from a heart attack and myocardial infarction.
Really?
So it is important to look into the whole thing. Talk to your doctor. I know sometimes it could be a little hard to do, but your doctor will understand and will pay attention to the details that are very important to look into it. Diabetes, for example, hypertension, coronary artery disease, obesity, radiation, multiple surgeries for the prostate, bladder, some medications, diet, smoking, significant alcohol consumption. A lot of things could cause erectile dysfunction. So it's important first, speak up, tell somebody. Better if you involve the partner, because sometimes when this happens once, and if nothing major, just the scenario, the fear for performance creates a vicious cycle that makes the patient very vulnerable and could potentially have a similar problem if this is not addressed. Second, if this is persistent, more reason to look for and talk to your primary care physician. Primary care physician will evaluate simple things like your sugars, your in blood, your high blood pressure, see if the medications that you're taking are adequate or not, and then fine-tune. If that alone didn't resolve the issue, sometimes the specialist needs to be involved. And what we do as a specialist, we look into things that are a potentially trigger factor for this. We do some tests to see how the blood flow to the penis is. How is this more psychological or psychiatric?
Do you do that in the initial evaluation, or does the patient typically come back for that?
The most important is the history and physical. So it will give us a lot of clues to how we can track the evaluation and potential treatment. And for treatment are very effective. Once you find the cause, there's staged approach treatments that actually most of the time we can get an adequate erection. From a very simple medication orally to injections, to vacuum, to implants. There's a lot of things that we can do, usually on a stepwise approach, and actually is very successful.
Well, we see all the commercials in the magazine ads for the different pills for this, and that, is that part of that what you incorporate into
this? Not necessarily, because a lot of these things that you see online or on magazines, they are just a mixture of different components of tablets, routes, and sometimes they are not standardized. We don't know exactly what is in those medications. Sometimes we recommend not to take them unless we know what the components are. I have patients that bring this to my office. I will look at it. Nothing says what is inside the capsule, so I will be very hesitant to recommend that to a patient. And I've seen patients that bought stuff online and they use them and they had problems afterwards. So be careful. Not everything that looks good is good. You need to do a little research and at least know what the components of this is. Just call them, the 800 number that you can look into when you're considering buying something and find out what is inside those capsules. The problem with this is that not being FDA approved, most of them might not have the same concentration in capsule 1 or capsule 10. So you might be taking a sugar pill afterwards. So it's very, very cumbersome. So it's better not to buy these, or unless you have, it's at a reputable place, or what is in the tablets. And you need to trust them that they put the same on each tablet. So it's complicated.
It is complicated, and it's something that if this is something you want to talk about, would want to sit down with Alejandro.
What is important is talk to somebody, involve your partner, usually that's the recipe for success.
Good advice. Good advice. Thank you so much, Dr. Alejandro Miranda Sousa. Glad to have you here again.
Thank you.
Always fascinating. Always good news for your health.
Okay.
If you have any questions for him or about Gulfstream Urology or 21st Century Oncology, go to our website. That's Fox 4 Morning Blend. Click.